So how would you treat chronic pain?
So for chronic pain, as we talked about in the last video session, we talked about inflammation. So certainly we'd want to address the inflammation and also making sure that the joint alignment for a joint, let's say that some person has pain in, like knee pain or shoulder pain or hip pain, is optimal. So through the holistic physical therapy and the integrative manual therapy, we would definitely want to make sure that the joint alignment was healthy, the environment of the joint was optimal. But also when we're thinking about inflammation being a real cause of chronic pain, we want to consider how to support the body to reduce inflammation through bodywork, through the integrative manual therapy. So one of the reasons why the body is in a state of inflammation is because it doesn't have the ability to drain toxins. The toxins just end up collecting in the body and creating this inflammation. So some of the routes of elimination in the body, like for example our renal system, which is essentially how we pee, so our kidneys through into our bladder, or also, our bowels, so our intestines into our bowel, essentially how we have stool. Those are really important routes of elimination. There are others, but those are sort of more the primary routes. So in IMT, in integrative manual therapy, we would want to make sure that those systems were optimally healthy. So we could use bodywork techniques in the IMT realm where we would be promoting circulation to those tissues, making sure that there was integrity in the tissues using different types of fascial release techniques, making sure that the tissues around those routes of elimination weren't in spasm, essentially doing different hands-on, very gentle manual therapy techniques to make sure that the person is able to eliminate properly. And then, addressing the body's overall health. There's lots of different parts of the body that are associated with inflammation. The liver, as we talked about in the last session, so doing different manual therapy techniques to promote the health of the liver, promote drainage from the liver, promote circulation to the liver, making sure even just that the bones that are sort of protecting the liver, like the rib cage, are mobile so that they're not restricting that natural rhythm of the liver to do its very important job of excreting toxins. So if we're coming from different directions, addressing inflammation, addressing the muscle, skeletal, joint health of where you're feeling chronic pain, the person is ultimately going to get to a place where they feel so much better. How would they know that they're better? Well, they definitely would have less pain because ultimately you're getting rid of the reason for the pain. They would have more energy because when we're inflamed, we're very sluggish, very lethargic. So as the inflammation goes away, the person's going to have more energy. If they have digestive issues secondary to the inflammation, those would lessen, maybe less cramping, less symptoms after eating, less heartburn, and overall just that feeling that you're in a good place. Ultimately that train wreck, you wake up in the morning and you feel awful. You have low energy, you don't want to get out of bed, you have that morning back pain. That would be different because the inflammation wouldn't be there. You'd be feeling good in the morning, raring to go, and overall would improve your mood.